Hello, how are you? Did you know that our muscles can be one of the main destinations for glucose in our body? And that strengthening the muscles in your legs can help you control glucose and even help manage type 2 diabetes? It's very important for us to know this. I'm going to tell you which two muscles in the leg these are. And when we manage to do strengthening exercises, they help a lot in controlling blood sugar. You're going to love this video. Stay until the end because you won't want to miss it. Before we start, I want to ask you if you do any kind of physical exercise in your daily life. And if you do this physical exercise, is it more for aesthetics, for health, or for the more functional aspect of being able to keep up with your daily activities? Do you do it for your mind, for your well-being, or do you not exercise at all? Are you currently a sedentary person? Write it for me down here in the comments and tell me how old you are. I'd love to see your comment. And if you can, leave a like on the video. It really helps me out here on the channel and shows YouTube that you support and trust my content. That ends up being super important for me. There are two muscles in our legs that can really help with glucose control when we work them the right way. And many people don't know about this fantastic benefit. Let's talk about that right now. Usually, when we think about controlling blood sugar, 90% of people think about diet and medication, right? And of course, those two things will help you a lot with blood sugar control, but what few people really know is that muscle is one of the main destinations for glucose in our body. After we eat, up to 80% of the glucose that enters the bloodstream can go to our muscle cells if they are active and if they are healthy cells. That's why people with more muscle mass have a greater capacity to better regulate blood sugar and avoid large fluctuations in blood glucose. And the opposite is also true, of course, right? The more muscle mass we lose, especially in the legs, the higher the risk of having more difficulty controlling blood sugar. There is one muscle in particular that protects us a lot against insulin resistance, which is the quadriceps, that large muscle located at the front of our thigh. So, it's one of the largest muscles in our body, and science has already shown that there is a direct relationship between the size of the quadriceps and blood sugar control. This has been scientifically proven. There was even a study published in the American Journal of Medicine that analyzed more than 13,000 people and concluded that the lower the muscle mass, the greater the insulin resistance and the risk of type 2 diabetes. In practice, this means that weak or atrophied quadriceps, when you have a decrease in the muscle mass of your leg, can make glucose metabolism more difficult. Whereas when our legs are more hypertrophied, or at least when we are able to maintain our leg muscle mass, during aging, we are able to keep our glucose metabolism working well, maintain our insulin sensitivity, which helps with proper blood sugar control. Exercise can help you even if you don't lose weight because during physical activity, we end up absorbing the excess glucose from the bloodstream without needing insulin. So the muscles become more eager for glucose, right? Because they need this energy during physical activity, they absorb more glucose and reduce the amount of sugar in the blood. So during this muscle contraction, the body activates these transporters called GLUT4, which pull glucose from the blood into the cells independently of insulin. So it really helps with blood sugar control. There's another muscle that's very interesting for our glucose metabolism, which is the soleus, located in the calf. And it's a particularly interesting muscle for controlling blood sugar because it primarily contains type 1 fibers, which are resistant and use glucose and fat continuously, even when we're at rest. And so we know that when we use this calf muscle in a regular way, the burning of glucose and fat can increase many times over, helping to control blood sugar. This muscle is also very important for our blood circulation. We even joke that the calf is our second heart, which is very important for prevention the accumulation of blood in the lower limbs, swelling of the leg. I have a video talking more about this, but now we also know that it's super important for improving blood sugar, for improving metabolism. So working the calf, working the leg muscles is super important for this whole metabolic issue. So, of course, you can do targeted exercises at the gym, and ideally, you should actually have the guidance of a physical education professional. But know that to work your leg muscles, you can do exercises using just your own body weight, without necessarily using weights, ankle weights, plates, bars, or any of that. Squats using just your own body weight can help you increase the amount of muscle fibers. In short, the stimulus for your quadriceps and soleus. Sitting down and standing up from a chair at home repeatedly can help you. It's an easier form of squatting, especially if you're older or feel less confident doing regular squats. Raising your heels or standing on your tiptoes can also really help you work your calves more. Lowering yourself a bit against the wall, trying to sit against the wall, right? Some people even use those Pilates balls, placing them against the wall for lumbar support and do squats there to be able to avoid putting too much strain on the spine and work all those muscles. And going up and down stairs, especially if you can do it on your tiptoes, for those who are more advanced, it helps work the quadriceps, soleus, and calf muscles, and it can really help control blood sugar. Ideally, you should start with 10 to 15 minutes a day and gradually increase, and of course, as long as you have medical clearance. And of course, the main thing is that you always have supervision from a physical education professional. I'm talking here about some exercises you can intuitively add to your daily routine. But to get better results, ideally you should always have an individualized prescription. Besides these targeted exercises, it's worth remembering that we should be as little sedentary and as active as possible in our daily lives. So staying active will also help you control your blood sugar, as I told you, going up and down stairs, walking more. If you're not very active anymore, a more active lifestyle will make you burn glucose without even noticing. Diet is also closely related, as I mentioned at the beginning of the video. So having a good diet is essential for controlling blood sugar. I have many videos here to help you. And obviously, if you already take medication, never stop taking it on your own, because that can be dangerous for you. Let me know if you notice that after walking, doing squats, or doing any leg exercise, your glucose control improves. How does that work for you? I would love to see your comment. Remember to like the video, it really helps me out. Share it with someone who will enjoy it, with someone who needs it. Let's work together to spread this chain of good. That's what I want here with the channel. See you next time. Bye.